Yes, I'm
Which
Joseph.
one?
I'm actually a nurse in the community, and I also work at a hospital, Banner. And
There's a Banner,
yeah, well, actually, Banner Heart.
Banner Heart
Hospital.
I've been in that hospital.
You have? Good.
I had a stent put in
Oh,
2012.
Actually, we recently had an interview with some of the individuals here, and they were telling me they had questions about heart medications. Do you take any heart medications?
Yeah, I take a whole bunch.
A whole bunch. Do you have a list? The most
Yeah.
common thing is people
I
tend to
carry
not have a list.
in my phone in the
Good, on your
emergency.
phone. That's a good place to have it.
See.
Anywhere that you can have it accessible, in your wallet, on your
that's
phone.
perfect, actually.
And so in healthcare, we, in the hospital and the long-term care centers, a lot of people that come into the hospital have a list of medications that they
Yeah.
take.
Yeah.
And a common mishap that happens is the miscommunication between maybe the list isn't updated or someone who's putting in the medications. You could imagine, let's say you're on a beta blocker that's 50 milligrams and someone puts it in as 100 milligrams because that was the old dose you were taking.
Yeah, yeah.
And those mix-ups can cause issues in health. You know, if you're taking double the amount of your
I've
medication.
seen disasters in emergencies
Yeah.
myself.
So when you make your medication list, do you just line up your medications and look at the actual, pill box or whatever you have and look at the name of the medication, for instance, metoprolol, and then put down the dosage, like 5 milligrams, 10 milligrams?
Overall,
Yeah. Do you take it twice a day, once a day?
once a day.
Once a day.
Yeah.
And so let's talk a little bit about these heart medications. So you take metoprolol. Do you know what the side effects of metoprolol are?
Well, there's so many that I can't keep track of.
You're right. If you look at the back of a bottle, or even on the internet, the list goes on and on and on.
Yeah.
But luckily, there are some common side effects that we can look at and learn from. So for instance, metoprolol, which is a beta blocker, it's actually on this list. If you look at it right back here, metoprolol. There's some other ones that kind of sound similar to metoprolol, carvedilol, atenolol. What does the medication do? It lowers blood pressure. So that's probably why you were prescribed it, right?
Yeah.
For
Yeah,
blood
I
pressure?
have high blood pressure.
So you have high blood pressure. That's called hypertension. It slows the heart rate. It also may strengthen the heart's pumping action over time. So if you have heart failure, a beta blocker over time can actually help the heart pump out more blood to the body. Okay? It's used to lower blood pressure. It's used to treat chest pain and future heart attacks.
How about headaches and that? Is that a
It
sign?
could.
Actually, when people come in for, like, if they're having signs of a heart attack,
Yeah.
it can be anything. Sometimes people say it's like pain in the jaw or they have a headache. The common the common symptom of a heart attack is like chest pain or something heavy on the chest,
What
or pain in the
happened
arm.
is my arm, I was walking around Springdale Village, and the fifth time I got this pain, and it was really hitting me.
And those were the signs.
Yeah.
Did you end up going straight to the hospital?
Yeah,
Oh,
yeah. I didn't have to go by ambulance, but
Yeah.
somebody took me.
yeah. So common side effects of the beta blocker, like metoprolol, remember we said there was this big long list of
Yeah.
side effects? A common side effect is because it lowers your blood pressure, you may feel dizzy.
Yeah.
And a lot of times where that dizziness comes into play is when somebody who's taking metoprolol is sitting on a bed, they take it, 30 minutes have gone by and they stand up quickly, they get really dizzy. So it's somewhat of a fall risk. So what I tell people who are taking metoprolol is to be very careful when they stand up if they feel dizzy, either sit back down or just stay still, don't start walking until that dizziness resides. Then they can start walking.
I had that happen in the bathroom. I turned around and suddenly I just started falling over.
And that could have been a side effect of medications.
Oh,
And that's why it's so important to know what your medications are and maybe some common side effects. So if you had taken your beta blocker, your metoprolol, you would know for like the next hour or two that you could get dizzy. And you could plan for it. And that's what my teaching was largely based on, is helping people understand the medications, to try to know all the medications they take and try to make a list. And if it gets hard, you know, let's say your list is really long. You have this 3 pages of medications. You can always talk to your primary care provider and say, is there any way we can reduce these? Are there things I'm taking that I don't need anymore? And, you know, try to make it as simple as possible.
Yeah,
and
my
obviously keep the
primary
meds you need.
Dr. Talley.
Tally, Dr. Tally?
Yeah,
I know
he
him.
reduced mine quite a bit when I came down here in Colorado.
And so along with medications, I was going to talk a little bit about activities of daily living or exercise. So activities of daily living are your everyday brushing your teeth, getting out of bed, taking a shower. And in order to extend our independency, exercise can help with that. You know, as we age, sometimes we need help with brushing our teeth and so forth. And most people don't like having help. They're like, I want to do it by myself, right? You want your independence. And how we increase that is being active, as simple as that. And this is actually a heart failure book, but I think if people with heart failure can exercise, anyone can exercise. And it says, make activity a part of your day, such as while you're at the grocery store, walk up and down all the aisles. This may be easier if you push on a shopping cart when you walk. Stretch your arms and legs while watching TV.
I use my walker as a shopping cart.
Perfect. And you can get exercise with that walker.
On it.
Good.
I've seen you using this walker and you're walking back and forth, and that is encouraging. That's
I
that's
can walk
exercise.
a pallet.
You can walk what?
I can walk a pallet.
Awesome. That's good.
And I do weights,
Oh, wonderful.
3-pound weights in the morning.
You know, when you do strength resistance, they call this isometric exercising. Do you know what that helps prevents? It helps prevent a lot of things, but also helps prevent osteoporosis. The more that we exercise, our bones become denser. It actually makes it easier to absorb calcium and vitamin D. So, you know, knowing your medications and keeping exercise is both really important to your health. You're a good example of that.
Thank you so much.